send you what I got. I sent it to Mary. I don't know if she forwarded it.
Good morning, everybody. Today marks 438 days since our first COVID-19. We are on week 63, and unfortunately, we had 379 people pass away from COVID-19. Some good news, though, we're at 60.6% of Albany County's population getting the first shot, 52.7% for fully vaccinated, which is good. And for 18 plus here, we are at 71.5% based on the state matrix, so which is good. All good news. So, some of the other good things. Last week I announced additional mobile pop-up vaccine clinics coming up, and one of which is at the airport today. And great partnership with the governor's office, with Department of Health, Colony EMS, the airport, Phil Calderon, and everyone out at the airport. Phil, thank you. So today we're providing free COVID-19 vaccine shots to travelers, the J&J, the 10 days. So starting today from 9:30 to 4:30 through Friday, by baggage claim area, you can get the shot. Free parking. So if you you're traveling, you'll get 30 minutes to park for free, and if it takes longer than that, Phil Calderon will pay for it. So the CEO of the airport. But again, this is a great opportunity for people that are traveling, had the hesitation, or want the 10 days. Please, by all means, take advantage of it. It's there. And these are more great partnerships that we're doing. Also, we'll have one this Wednesday, May 26th, at the Church of St. Patrick's in Ravenna. So thank you to everyone down there and supervisor, everyone helping us get that together and their EMS system, 4 p.m. to 7. This is in partnership with CDPHP, Community Care Physicians in the town of Queens. So to George McHugh and them, thank you so much. We also have two more at West Hill Refugee Welcome Center at 104 Ontario Street in Albany. And there'll be one tomorrow, May 25th, Tuesday, June 1st, June 1st, both from 4 p.m. to 7. You won't need an appointment. You can walk up. You can get the vaccine. And, what's so important, too, is that there'll be someone there you can talk to if you got any hesitation, or we're finding out, for some reason, the people that have been on the fence find it easy just to walk up and not think about it and get the vaccine, which is fine. That's fine, too. You can also get the Pfizer vaccine every weekday at our County Department of Health, 175 Green Street. Dr. Whalen and her team have people there to talk to. You can talk about whatever your issue might be. And to Dr. Whalen and her staff, thank you, because it does mean a lot. Because a lot of people, believe it or not, and Dr. Whalen was a physician for a long time. People don't have. I won't take the doctor away from you. But they don't have their own personal physicians. They don't have pediatricians for their children. So we're there for you if you need to reach out and talk to somebody. I know for whatever reason a lot of people don't have their own private doctors, but we will be there to help you out and answer them questions. We're also giving free transportation for seniors over the age of 60 and their caretakers, and you can call us at 518-447-7198, and again, it's free. We'll pick you up, get you there, get your appointment, get you home, and it's all free and nothing to worry about. So please take advantage of that. If you're not able to leave your house, and I got a couple of questions that I guess I should memorize this number. I always forget it because someone was asking me this over the weekend. I'm like, wait till Monday. I'll give you the number. I did try calling you, Mary. You didn't pick up. So anyone with a disability who can't get out of their house and need someone to come there and get the vaccine, please just call this number, 518-447-7198, 447-7198. Same number when you set up your appointment for the 60 and over. And we'll get somebody to you. We'll get someone to you to pick it up. We'll get someone to you to get to your house. The sheriff's department's out doing this, through EMS. Everyone's doing, we're all in partnership. So please, by all means, if you can't get out and you're that person, we'll make sure that you get it. Additionally, we're offering the walk-in visor vaccine this Friday, May 28th, at the Emmanuel Baptist Church, 275 State Street in Albany, and anyone can show up anytime between 10 a.m. and 1 p.m. No appointments necessary. Again, this is with CDPHP focused churches. As of today, there's 24,269 cases, only 17 positive cases today, which is good. We went down, going up a little bit, but again, over the last 5 days, our average has been 17.6. The 5 days before that was 17.6, so we're holding our own, which is good. Of the new cases, 5 don't have a close contact, 12 don't have a clear source of infection. So again, people, please continue to do the right thing, and cough in your hand, wash your hands, stay 6 feet apart, and if you're not vaccinated, please wear your mask. There are now 105 active cases in Albany County, 306 people under mandatory quarantine, and yesterday that number is 295. 19 recoveries since yesterday, and there are no new hospitalizations overnight, which is awesome news. 10 people currently in the hospital from the virus yesterday. We're at 10, but this number has dropped down from 14 since our last briefing on Friday, which is good. There are 4 patients currently in the ICU, and that was 4 the day before too. So we continue to urge people to go and get tested. If you're experiencing any flu-like symptoms, please. You should also continue to wear a mask if you aren't fully vaccinated, which means 2 weeks after your last shot. And please continue, like I said before, to cough into your arm, clean your hands, and stay 6 feet apart. And, which is all good stuff. And again, please, by all means, you can go to our website and at albanycounty.com for more information on this. Dr. Whalen.
Good morning. So the numbers are going in a positive direction. We're seeing less cases of COVID in the community, and we're seeing higher rates of vaccination. This is where we want to go, and it's where we want to be, but we need to continue to work on increasing the numbers of those that are protected by a vaccination. So we continue to encourage those that have not been vaccinated. If you have questions, please don't hesitate to reach out to us. There is a tremendous amount of misinformation about the vaccines on the internet, on social media. Don't get your information from Facebook. Please get your information from a trusted source, including your physician or your local public health department. We have public health educators that are happy to provide information to people and really give them the best information that can help them make an informed decision for themselves and their family members. We continue to stress the importance of vaccination for over 12 and have been very happy with the numbers that we've seen at our clinics and those walking into the health department. We are working with a number of school districts on ensuring vaccination can be available to their students, and I think it's rolling out as well as can be expected right now. I will say, as the county executive said, that dropping the mask mandate was for those that are fully vaccinated. And again, that is for those that have received 2 weeks after the last dose of whatever vaccine you got. It's really important that we all realize the importance of continued mask usage for those that are unvaccinated. And this includes utilizing masks for sports, particularly high-risk sports. So we do not get clusters of illness in the community and cause larger problems. It is still something that we very much have to work on together to make sure that we are protecting ourselves and those that have not yet been able to be vaccinated. So that is something that I want to stress today. I think it is something that we need to, have conversations with our friends, family members, with our school districts, and with sports teams to ensure that people are continuing to protect themselves. Please don't hesitate to reach out to us if you have questions, concerns. We are vaccinating 5 days a week. at the Health Department from 9 to 3. We look forward to more community outreach efforts. We had a great pod at Capital District Latinos yesterday, and we're able to administer 42 Pfizer doses, and look forward to getting out into the community more this week. So please reach out if you have any questions or concerns.
Thank you, Dr. Whalen. Again, to you and your team, as always, great, extraordinary job you're doing. You know, on Friday, we were joined by the Empire coach to announce the VAC party at the Times Union Center atrium for the first Empire home game on May the 29th for anyone who is vaccinated. We also have a vaccine pod that same day, and anyone can get the shot, and it's free. And we'll get a free Empire ticket to future games starting June 12th. But we want to keep the incentive going, and we want to keep trying to come up with different ideas of how we can get people vaccinated, and especially certain age groups. And I'm joined today by the president of the Albany FireWolves, our team, who's the National Lacrosse League. George, thank you for joining us today. I appreciate it.
Thank you.
And I'm proud to announce the first 1,000 residents between, now get this right, and Jeff, this doesn't apply to you or Dan Lynch, between the ages of 12 and 15 years old get the vaccine at one of our Albany County vaccine clinics will receive a free FireWolves ticket for the season when it starts later this year, which is so exciting because when we talk about light at the end of the tunnel, to have arena football and lacrosse coming, really gives people hope. And it's we've always supported lacrosse and arena football, but lacrosse too has grown so much in this area, and to have this league here, George, and to really give people that opportunity to say yes, hopefully, I'm vaccinated and get to see a great game and get back to some type of normalcy. But again, first 1,000 people that walk through the door, 12 to 15, will get a free ticket, and George can talk about what goes with that free ticket and other things. So I do want to say to to your organization and to you and believing in our community and coming here, I really appreciate it. It was a shot, the third shot in the arm we needed to give people hope and opportunity, let them know that we are trying to get back to some type of normalcy. But George, please.
Yeah, thank you, and good morning, everybody. To go off with the county commissioner was saying, we 100%, when we came to Albany, we came with the goal of not only bringing a professional sports team back to Albany, but also to give back to our community. And officially, this is our first initiative. We created about 2 weeks ago, we announced the FireWolves Foundation. We have an initiative that we call the Pack Gives Back, and this is our first initiative. So what we're doing is to help the community to get immunized and encourage immunization. The goal for us is to focus on our kids and our youth, and this incentive for us was for that age bracket of 12 to 15 years old. If we can encourage those folks and the families to have get the vaccine, each one of those folks will receive a certificate, and the first 1,000 will receive a free ticket to our home opening game. So I'd like to really thank, for helping us create the foundation, our ownership group, and our CEO, led by Oliver Marty. I want to make it known that these folks are scattered around in different parts of the world, and they are trying to be part of this community. And the way that they have done so initially here is they started and they actually funded out of their pockets. They funded our foundation so we can get up and running immediately. So what you're going to start seeing is how we can be part of this community. This was our first initiative to give back, and the Pack Gives Back initiative. So we wanted to start with really a foundation of the youth, and really helping a program like this and encourage people to get their vaccinations. And for us, that means everything, so we can get back to some sense of normalcy, and that's the hope here. And we encourage everybody to do so as these pods open up this morning.
George, thank you, and it means so much. And so when a 12-year-old gets a ticket, or a 15-year-old, 12, 13, 14, or 15, their parents, their parents will receive some promotion to come, the vaccine certificate that you just talked about, and the foundation. And it really shows how you want to be part of our community. So to your team, thank you so much for everything. And to Albany FireWolves, it's going to be exciting to look forward to. And I'm hopefully by then we won't have 33% of our arena that we can stay open, or have a vaccine section versus a non-vaccine section, that will be good to go. And so thank you so much. But next Monday, May 31st, nearly all COVID restrictions on restaurants will be lifted. The 12 a.m. curfew on indoor seating will be the last to go. So we'll be back to normal. And why it's important that this is happening, it's also important to remember that restaurants' revenue has been down. One of the things, alcohol to go, has been a big push, and I want to thank Assemblymember Pat Fahey and John McDonald for the press conference they had, and Feed Albany and all the restaurants, Jason Savoy, everyone that's been involved with this. It's really helped them with revenue. It's really helped them to go, and it's unique, to get that home delivered food with that signature drink that you like from that restaurant. They're not looking to sell bottles of wine or beer there. It's just usually their signature, their thing. So that, which I will continue calling the state legislature and governor to pass this legislation, which will be extend alcohol sales by at least 2 more years, which comes up very shortly. So please, and the New York State Restaurant Association's released a new poll that found that 78% of New Yorkers support the permanent extension of this alcohol to go. So thank you to everyone involved with this, trying to make it happen. Those who want to get the vaccine, wrapping up here at state-run sites, please visit it, the website, or go to their number, 1-833-697-4829. I know at the old Lord & Taylor's at Crossgates, you can walk in and they give you the opportunity to pick whatever vaccine you want. And I know, I'm pretty sure FEMA's has pulled out completely at all their sites here in Albany County. Their states are running the sites now to Washington Army and the other places, and that's the same thing. And I also heard about workers going outside on the street just trying to get people to come in to get the vaccine. So everyone's just trying to get through this. Again, thank you to United Way for our 211 and the Albany County. You can go to our albanycounty.com website to get all the information you need, mental health support, which I think we may be ending next week because, they're really down to just maybe getting a phone call a day, which is so awesome. It means people, we went from a high to a low, which is good. People are used to the new world we're entering or have entered and gotten over what we look like 15 or 14 months ago versus what we look like today, and how things are differently operated. So our mental health support line is still available, though, at 518-269-6634. Our 24-hour sexual assault hotline, 447-7716. And again, please, people, stay safe out there. I still had this question as going around wearing my mask. People are like, why are you still wearing your mask? You're fully vaccinated. It's to support the people that aren't, the people that don't want to get it, but also to let people know it's okay to continue to wear it. And I was surprised being out and about at different events this weekend, how many people are still continuing to wear it, going to stores. I went into one store, and they were like, why you got your mask on, county executive, get it off. And I'm like, again, to just be supportive. Again, everyone takes things differently. And, just be there for them. Just remember, we all handle stress differently. Be safe out there. Do the right thing. Wear your mask if you're not vaccinated. Cough into your arm. Clean your hands. Stay 6 feet apart. And be safe out there. Any questions?
All right. So, Dr. Whalen, I would like to start with you. Just what is your reaction to this CDC investigation with younger teens kind of possibly having a reaction, some kind of heart issue to the COVID vaccine?
So I think you're referencing a report that came out on May 17th from the Advisory Committee of Immunization Practices that they're doing very, very detailed surveillance of everybody that has gotten the shots, and they have found that there is an incidence, very low, of myocarditis, which is an inflammation of the heart muscle, in some teens after an mRNA vaccine. But, here's the big but. When you're looking at a large population of people, to talk about causality, you have to say it's above what you would expect in a normal population, and they haven't said that yet. So this is something that could affect people within that population if you surveyed them with a population without vaccine. So what they're doing now is trying to determine those numbers to say, is this something that's out of the ordinary? And we're still waiting for that data. I think that for all, the message I think that should come out of this is the incredible data monitoring of people who have been vaccinated, and how this is being very closely followed, and how the public is being brought into this information as soon as it comes out. but it is not at this point a jump to causality. So this is not yet beyond what we may expect, or we haven't received confirmation that it's beyond what we may expect at this in this age group. So I think that it's something we have to keep our eye on and see what the data shows. We have not seen any incidences of that in Albany County, and we have had thousands of kids vaccinated that have done very well.
So what is your message for parents who maybe saw that report and are nervous now?
Sure. So, I think this doesn't change my message to parents. I think parents, really need to have conversations with their pediatricians and get information from their pediatricians on this and what the pediatrician's take is on this. It's all about speaking to a trusted messenger, and people need to feel comfortable. And so I encourage people to get as much information as they possibly can. And, you can go online to the CDC and look at the report itself.
And a second question for you, just in terms of the state guidance with kids, as young as 2 now being suggested to wear masks at daycare settings, summer camps. There's been a lot of confusion out there from parents as to why this is kind of now coming up from a medical perspective. Can you explain?
So, the guidance thus far has suggested, it's kind of a little bit of a turn on its head, that people under 2 should not wear masks. But now the guidance is saying people over 2 should wear masks. And this state guidance is consistent, with guidance from the CDC. I think it's really looking at how we're protecting our unimmunized. And kids from 2 to 12 at this stage still cannot be immunized. So it's the same rationale that all of us have used for mask usage, and hopefully later in the summer we'll be learning more about availability for vaccination of a younger group.
Of the 25,000 cases that Albany County has seen, how many fall into that 2 to 12 age group?
I don't have that number on me, but I can get it for you.
And also, in the UK, with the Pfizer vaccine, they delayed the second shot for pretty much like the older group because they wanted more people to get their first shot. And they found out that after 12 weeks, the immune response was 3.5 times greater. If that deems to be true in a peer-reviewed study, do you think the vaccine schedule could change?
Well, it's possible. Currently both Pfizer and Moderna have been studied as a 2-dose regimen. Pfizer 3 weeks apart, Moderna 4 weeks apart. But as we get these studies and learn about, how protected you are after a shot, there's a possibility. Right now we know that those that receive, the reason they did that in the UK, first of all, was a supply concern. They did not have enough vaccine and they wanted to make it last longer for more people. We don't have this concern in the United States, and certainly in our area, which is a good thing. So currently, we are utilizing the data that we have on hand to administer the 2-dose, which we know gives about 95% protection. But with all of this, with COVID disease, with our response, with the vaccination, we are looking at data as the data evolves and then modifying practice and policy based on the data.
County Executive McCoy, there was multiple shootings in the city of Albany over the last 3 days, 2 people dying. Has there been any talk with the city about the partnership that you had in place last year with the state police and the sheriff's office? And then are you actively talking with the city at this point at all?
I have not, and it breaks my heart being I still live in the city of Albany, growing up in the city of Albany. To see what's going on, and we need the community to come together because this summer is going to be worse on record than last year, and we need all resources. And it's just not about more policing, it's about education, it's about taking ownership with the residents of these neighborhoods and the clergy and the politicians and the community activists coming together. I would like to see a unity walk for this, against the violence that are happening in these communities, because kids are afraid to walk down the street, and to have shootings in the middle of the afternoon is very disturbing. You know, when I was a kid growing up in the South End, you had stuff happen at night, but not 2, 3 in the afternoon. 18-year-old girl from high school gets shot, you know, at 3 o'clock in the afternoon. It's not a good look for the city. And we need to work together to come up with solutions to the problem, but work together to end this violence. So I'm available. I know the mayor and I have a great relationship, and you know, she has a lot going on right now, but she needs help. It's not one person that's going to change this, and it's easy, like I've said, with COVID-19, you can point the finger, but be part of the solution, not part of the problem. And let's get together, and you know, let's have a unity rally so we can stop the violence and give opportunities to these kids, take guns out of their hands, and you know, and give them an opportunity to better their lives, not through violence.
Okay. One quick question for you, George. Basically, what are you hoping that your season looks like in December with this vaccination rollout continuing, and with the encouragement that your team is giving for these younger teens to get vaccinated?
Yeah, that's a great question. We had an opportunity to start the National Lacrosse League back up. We'd be currently playing right now. We chose not to, knowing that December would start our new season. And we feel just the direction how things are going, and just kind of the track record we're seeing laying the foundation right now with, you know, masks coming off and more people getting the vaccine. The hope is that it's 100%. The reality is we don't know, but we're acting as if right now it will be 100%. But you know, we feel that it'll be more than 33% than it is right now, and somewhere in between. And we can basically exist under those circumstances. We hope it's 100%, and we hope to pack the house. And I think we will do so. And I think it's going to be time for people to get out and enjoy themselves again. And people are going to be ready to do so. So we're ready for that. Thank you.
Any other questions? Thank you, everyone. Thank you, George. Thank you to everyone, and stay safe out there, everybody.